More hospital beds, but no more hospital staff. It isn't unusual for the health service to struggle over the winter months, but pressure from the pandemic once again is unrelenting. More than 20 NHS trusts across the country have now declared a critical incident, and in Greater Manchester, non-urgent surgeries and appointments have come to a halt.
I and colleagues are extremely sorry for the very difficult decision that we had to make. That hasn't been made lightly. What we want to do is try and make sure we minimise the impact as much as possible by, as soon as this is over, returning to try and recovering through our non-urgent work in order to get those operations done.
It's staff shortages from COVID infections and isolation which is driving this current crisis in the NHS. Royal Bolton's A&E department was today working with less than half of its doctors. Nurses now doing overtime as their colleagues call in sick. Health bosses are monitoring the situation carefully and anxiously. The staffing crisis across Greater Manchester is 2 to 3 times the normal level. And whilst for now they are holding on, the days ahead are difficult to predict.
It's deteriorated, full of arthritis.
For Steve, a long-suffering patient, this decision in Greater Manchester is a devastating blow. A much-needed operation on his knee has been pushed back once again.
Demoralising, really, because I really wanted it done this year so I can get back working before retirement age. It's all immobility, and it's pain at night, pain in the day. It's constant sometimes, and it's never ending. Just keep waiting, just like everyone else.
Across the region's hospitals, there are now in excess of 1,200 patients with COVID-19. In some, more than 1 in 5 people have the virus. The PM's plan to ride out this wave doesn't sit well here.
That isn't a phrase that we would use from our perspective here in Greater Manchester, because I don't think it does justice to the position in our public services and the pressure that staff working in the NHS in social care and on the front line in other services, I don't think it reflects the position that they're in.
But pressures are being felt across the nation. North East Ambulance Service today asking people with chest pains to take a taxi to hospital rather than wait for a paramedic. All signs of the desperate situation our health system is in, one which is already playing catch-up, and with a warning of challenging weeks ahead, that problem may only deepen. Inzamam Rashid, Sky News, Bolton.